Hello, I'm Deborah Duro, Pediatric Gastroenterology and Program Director at the Sala Foundation Children's Hospital. Today I'm very excited to share with you our Blenderized Tube Feeding Clinic, which consists of myself and 3 registered dietitians, Cristiane Schneider, Jenna Romanelli, and Sonia Motolongo. This video presentation will cover the benefits of Blenderized Tube Feeding, patient selection, equipment need, food safety, recipe creation, a demonstration of creating the Blenderized Tube Feeding, and a demonstration how to push Blenderized Tube Feeding through a G-tube. So what is Blenderized Tube Feeding? It's a combination of whole foods and liquids, typically made in a kitchen environment, mixed in a blender, and provided through a feeding tube, as either as the sole source of nutrition or part of the nutritional support regimen.
There are many nutritional benefits of using Blenderized tube feeding. These recipes include a variety of real foods, which adds nutritional value and fiber. Recipes can be individualized to accommodate cultural and personal preferences, specific diet restrictions, and avoid any allergens, intolerances, or sensitivities. In our clinic, we create recipes that are dairy-free and plant-based, improving the microbiome and boosting the immune system of our patients. The clinical benefits of Blenderized tube feeding show improvements in feeding tolerances, such as reduction of gastroesophageal reflux, retching and gagging, constipation, and oral aversion, as well as increased volume tolerance. Additional benefits of Blenderized tube feeding include normalizing meal times, experiencing different appearances and aromas of foods, participating in food preparation, and creating nurturing relationships with loved ones. And lastly, Blenderized tube feeding can be less expensive than commercial formulas. Patients are selected for the Blenderized tube feeding clinic based on certain criteria. Patients must be greater than 12 months old corrected age, medically stable with appropriate weight gain, not immune compromised, have a G-tube size 14 French or greater, and able to tolerate bolus feeds to qualify for Blenderized tube feeding. It is important that the patient's family has the capability, time, motivation, and understanding of the commitment required. There are many appliances and medical supplies needed for Blenderized tube feeding. These include, but are not limited to, a high-powered blender such as a Vitamix, NutriBullet, or Ninja, a 60 milliliter syringe with plunger and bolus extension, airtight containers, ice cube trays, refrigeration and freezer space, a food scale, measuring cups, measuring spoons, kitchen utensils, and a feeding pump if using. Food safety is of utmost importance when creating Blenderized tube feeding recipes to minimize the risk of foodborne illness. These steps are necessary for food safety: proper hand washing, thoroughly washing produce, cooking foods to at least 165 degrees Fahrenheit, chilling and freezing foods immediately, keeping refrigerator and freezer below 40 degrees and 0 degrees Fahrenheit respectively, routine cleaning of blenders and utensils, completing feedings in less than 2 hours, and properly defrosting frozen Blenderized tube feedings. In our clinic, Blenderized tube feeding recipes are made up of fruits, vegetables, grains, protein, non-dairy milk alternatives, and fats. The serving size of each ingredient depends on the caloric amount of the recipe, with recipes ranging from 800 to 2,000 calories. A registered dietitian should develop these recipes to avoid any nutrient deficiencies and will prescribe the most appropriate recipe to meet each individual's needs. The first step in food safety is proper hand washing. Step 1. Wet hands with water and apply enough soap to cover all hand surfaces. Step 2. Rub hands palm to palm. Step 3. Right palm over left dorsum with interlaced fingers and vice versa. Step 4. Palm to palm with fingers interlaced. Step 5. Backs of opposing palms with fingers interlocked. Step 6. Rotational rubbing of left thumb clasped in right palm and vice versa. Step 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Step 8. Rinse hands with water. Step 9. Dry hands thoroughly with a single-use towel. And finally, Step 10. Use a towel to turn off the faucet. At minimum, hand washing should take at least 20 seconds. Today, we'll be demonstrating how to make a 1,200 calorie recipe. We're going to start by thoroughly washing all produce with running water. Next, we will measure all ingredients. This recipe consists of all organic ingredients, including 1 cup of banana, 3/4 cup of carrots, 3/4 cup of broccoli, 2 cups cooked quinoa, 3 ounces chicken breast, 2 cups pea protein milk, and 4 teaspoons of coconut oil. Place all ingredients in a blender and blend until the consistency is smooth. The amount of time required to blend will vary depending on the type of blender you have, as well as the types of foods and the amount of liquid in the recipe. The consistency of the blended food should be somewhere between fruit juice and that of a creamy soup, like this. Notice the difference in the consistency of the properly blended recipe versus one that is too thick. Using a 60 milliliter syringe, push blended foods through the G-tube. This shows you how easily the proper blenderized foods go through the tube. In contrast, notice how the thicker consistency does not push easily through the tube. In order to avoid tube clogging, use a high-quality blender, sufficient amount of liquids in blends, flush tubes with water frequently, avoid foods that cause clogging such as blueberries, string beans, flax seeds, and cooked eggs. It's important to properly store blenderized foods using airtight containers that are labeled and dated properly. You can store blended foods in the refrigerator for up to 3 days and in the freezer for up to 4 months. For more specific storage temperatures, visit the USDA Food Safety website. Thank you so much for viewing our instructional video. We hope it provided you with the initial steps in understanding the importance of having a multidisciplinary team when starting blenderized tube feeding in the pediatric population. For additional information about our blenderized tube feeding clinic, please visit Salah Foundation Children's Hospital at browardhealth.org or contact us at 954-712-6623.